Okay, well, welcome to this talk. We're coming straight from Ireland today. A special report from PJ Coogan, who works for Cork 96 FM, does the daily talk show there. He's kindly come on the channel before. And there's no substitute for getting a report from people that are informed on the ground. And PJ is in Southern Ireland there in the beautiful area around Cork. So COVID-wise, PJ, how are things going at the moment in Ireland?
John, we're concerned. We're quite concerned. Our National Public Health Emergency Team gave a very stark briefing earlier in the week, and we have paused our planned reopening because Delta is on its way to being, and pretty much close to being, the dominant strain. Now, yesterday we had 512 approximately new cases reported. Now, just for the sake of comparison, this time last year, our 14-day incidence of COVID nationally was 150 odd. So in one day alone, we've had multiples of what was our 14-day total last year. So the thing is on the rise again. Now, also, that must be contrasted with the fact that we have quite a successful vaccination program. As of last evening, just checking the numbers, we've about 48% of our population double vaccinated. And there's a change as well been announced by our Minister for Health yesterday that as of Monday, anybody over 18 who wants one can book in with their local pharmacy. About 700 pharmacies taking place around the country can book in with the local pharmacy and get a Johnson & Johnson vaccine as soon as one becomes available. And after the 12th of July, they can do the same for the over 18s with the AstraZeneca at a vaccination centre. On the other end of the scale, they are working down through the age cohorts, continuing to do that. They're currently in the 35 pluses. So I think the idea of the hope of our advisors is that, yes, this thing is going to take off. In fact, our Chief Medical Officer, Dr. Houlihan, said during the week, there is no stopping this. It is coming, and we can do very little about it except try to mitigate it, ideally mitigate it with vaccines. So over the next 2 to 3 weeks, we see a huge acceleration coming in the vaccination program, which is already quite advanced, to be fair.
So, but you also see increasing number of positive diagnoses.
Yes.
When do the Irish medical authorities think that this is likely to peak?
The projections that we were given during the week were saying early to mid-August. That was the projection. Now, there's a caveat with that, John, because there's also a question mark over the projections in that the modelling that was published didn't take into account the acceleration in vaccines. So we may get a new set of models early next week. But the facts are, it is on the rise. Delta is on the rise here. And we have paused our reopening as a result of that. And I would call it, and this is a personal view, not a state view, I would call it an urgent uptick in the speed of vaccination to try to catch it before it becomes a peak, before it becomes. Now, our experts did warn, and I was speaking on my own program yesterday with a pediatrician who also acknowledged there would be some concern in the autumn time if we didn't get a grip on it. There would be some concern about schools because obviously we're not vaccinating children.
Yeah. So it's over 18s in Ireland, the same
Yes.
as it is in the UK. Yeah. Okay. Now, what's public acceptance like? Have the public realised that this is actually, hopefully, the last sort of sub-emergency or emergency situation of this pandemic, we hope, but have the public realised how important it is at the moment?
The uptake of the vaccinations in Ireland, John, is one of the highest, if not the highest, in the European bloc.
Yeah.
There is vaccine hesitancy. There is vaccine doubt. People did get scared with the stories about clotting with AstraZeneca. People did get worried when Johnson & Johnson was initially pulled in the US. But people have taken, I think myself anyway, a fairly rational balance in their minds. And they said, look, right, there is a risk. But the risk of getting this thing and getting sick from it and having to be in hospital with it far exceeds the risk of the vaccines. And I have a daughter in her 20s, and she just cannot wait to get in and get vaccinated. And I think most of her friends are like that too. And the pharmacies that I've been speaking to since that announcement was made yesterday, we spoke to some leading pharmacists in Cork, and they already have waiting lists of people to come in for their vaccine once the supply comes. Supply is an issue because the plan is to start Monday. There isn't supply as we speak, but we have a fairly good rollout planned. So as soon as there's stock in the pharmacies, it will be taken.
So does it sit around on the ports for a long time in Ireland, or are things fairly
No.
well organised in terms of logistics?
We have a record, which the HSE, that's our health authority, is quite proud of. Every vaccine that arrives in the country is used within 7 to 10 days. So we get them out fast.
I did know that was the case, actually. I was being a bit naughty asking that. But and the military's been involved, I believe, in Ireland.
The military's involved at a logistical sense in that our military have a global reputation for logistics. And they've been taken into the vaccine centres and they've done some of the rollout and they've helped to get deliveries out around the country. We've 2 major vaccination centres here in Cork City, and both have some soldiers in them, just showing people through, making sure that everything works. Because one thing about the Irish Army, John, if you have a problem that you need to get something from A to B to C, there is no better trained body of people than our military to do that for you.
Absolutely, yeah, and we do know that has worked particularly well in Ireland. That's one of the strengths. So, very encouraging news about the increase in the vaccine rollout after the difficult start. I think it has to be said, and the problems.
I should point out we are still worried. I should point out. Sorry to cut across you. We are still worried about one cohort, because of the 12-week AstraZeneca delay, which has now been cut to 8 and now been cut to 4 by our authorities. We do have a lot of people in the 60 to 69 category that have not had a second vaccination. Some of them are quite vulnerable still. We have a bizarre state of affairs where there are more of the over 50s double vaccinated than there are of the over 60s. A lot more, in fact. Now, our health authorities and our minister have said that will be sorted. He said yesterday morning on national radio, he said that will be put right within 10 to 12 days. And already on my program yesterday morning, we were getting messages from listeners who had been waiting a long time and had just gotten their text message to say that we're going. So we'll watch it with interest, but there's a huge effort underway to get the 60 to 69s double vaccinated. What we haven't moved on here, despite many of our immunologists saying it, is heterologous vaccination, using the Pfizer as the second.
Sure.
We haven't moved on that yet. There's a lot of pressure on the authorities to move, but they're not gone there.
They haven't been there yet. I mean, the data to support that is accumulating strongly, as you all know. But obviously, everyone's got to go by the national guidelines. So, are people still complying with the social distancing, the mask mandates, the ventilation?
People are getting very tired of it, John. This is summertime. We like to get out and about. We like to see people. We like to socialize. We're the social nation. The plan was that we would be able to eat and drink indoors from this Monday. That's been put aside. There is talk of bringing a system like operates in Denmark, where they call it in Denmark the Corona Pass. There's talk of a Corona Pass working here. That's being looked at. But strangely enough, the hospitality sector doesn't like that idea at all.
Really?
It seems to have an issue with implementing it. People worried about, is my personal information going to be known to the owner of my local pub? And I suppose that's a hesitation that people will have, but it's in the mix. Whether it happens or not, I don't know. The next stage is we're open to international travel from the 19th. The hope is that by then there'll be a plan for vaccinated people to eat inside if they want to. But right now, it's just outdoors. And the Irish weather is probably less predictable than the British weather. We had a glorious week, but the weekend is pretty grotty, which is unfortunate for outdoor dining.
Yeah, and I imagine Ireland will be using the European Corona Pass at some stage as well.
Yes. That's to kick in on the 19th.
I see. Right.
The QR code. We've agreed to that, but for some reason, our government didn't take it on from day one. They're waiting until the 19th. Okay,
fair enough. The last thing really, PJ, hospital admissions, people getting sick, pressure on the healthcare system.
They are low. Now, to be fair, that is one thing we're quite positive. Now, the number of hospital admissions is creeping up very slowly.
Yeah.
But if you compare it back to January, when we had that terrible surge here.
Yeah.
Like every 100 new cases, you were almost certain to have 5, 6 people in hospital.
Yeah.
That's not happening. And in the vaccinated cohorts, we're not getting hospitalizations. Our concern, obviously, I think, as observers, is that Delta will take off in the unvaccinated cohorts, and that you will get a percentage of people going to hospital. But at the moment, our number of people in hospital, if my memory serves me correctly, is less than 60 nationally. And our number of people in ICU is about 15 nationally. Now, it should be said, John, Ireland has a chronic shortage of critical care beds. A chronic, we only have about 350 at a push nationally, critical care and ICU beds. You as a nurse yourself know the importance and the difference. We only have a capacity at the moment of about 50 that are vacant. So we couldn't possibly take a surge. And I think that is really part of the urgency of the situation. We cannot go back to what happened in January. We cannot go back to what happened last April. That surge was just horrible to watch. Now, the hope is that the vaccines will work to the extent that we will never have to look at that again.
Yes.
But obviously, we have to prepare for the worst and hope for the best.
From what you've said, I think I would have guarded optimism about the Irish situation at the moment. I think that would be the kind of consensus of opinion.
The worry is to get out the second dose to those who are not yet. And a lot of those people, we would, unfortunately, because of the way it worked, would be that we have people who are immunocompromised and immunosuppressed caught in that gap at the moment. Yeah. And that's a worry. That's a serious worry.
There are probably going to be people that need to guard themselves for a period of time for this Delta outbreak as well.
I would think so, yeah.
Which is unfortunate, but I don't really see too much alternative, particularly people that are not generating an immune response, people with cancers on chemotherapy, or HIV, people who've got any form of immunosuppression. But yeah, PJ, that was an excellent, concise report. People all around the world, of course, taking a keen interest, like me. People all around the world watching this have got Irish ancestry, and I'm proud of it. And there'll be a lot of interest, so we appreciate that. Thank you very much.
Always a pleasure to speak with John. Thank you very much.
Thank you. Thanks.
John, I wanted to catch up with you today. It corresponds with a huge ramping up in our vaccination program in this country, announced on Friday by our Minister for Health. Yeah. Everybody over 18 can get a Johnson & Johnson in the local pharmacy. They can get an AstraZeneca in a vaccination centre from about 8 to 10 days' time. We're working down the age cohorts as well with Pfizer and Moderna. So the hope is that within another 4 to 5 weeks, we'll have a huge increase in the numbers of people vaccinated. Good. What I wanted to talk to you about, John, is the effect of vaccination against Delta, because I think many of my listeners are confused and maybe a bit frightened. They think, well, I've had my 2 doses. Why is there so much concern? Am I safe? If Delta comes into my neighborhood, into my house, into my office, am I safe? I'm double vaccinated. What's the data telling us, John?
Yep. Well, we do have data on this from the United Kingdom. Now, in the United Kingdom, of course, the Delta arrived first after India. We had a lot of it. So we've actually had time to accumulate quite a lot of specific data on the Delta variant as it reacts with the 2 vaccines that we're using mostly here, which is the Pfizer and the AstraZeneca. Now, in terms of the Pfizer vaccine first, and this data is specific for the Pfizer BioNTech vaccine versus the Delta variant of the coronavirus, it is less efficient. It's about 6% overall is roughly the figure of reduced efficiency. Now, if we take the efficacy against symptomatic disease, then after 1 dose, it's only 36%. So that is people getting any symptomatic diseases. But after 2 doses, that goes up to 88%. So one of the big changes we've got with the Delta variant is that 1 vaccine dose is not protecting as much, but the 2 vaccine doses is protecting to a high level, almost as high as it was with the previous strains of the virus. But as well as that, people have had 2 doses of the vaccine, especially. They get less clinical features. So instead of getting about 5 features in the first week, they'll probably only get 1 or 2. They last for longer and they tend to be milder. So less likely to get symptomatic disease. But when we look at protection against severe disease and hospitalization, the data is actually even better. So with the Pfizer BioNTech versus the Delta virus, one dose gives a 94% protection against hospitalization compared to someone who is not vaccinated. So it really is significant. So 2 to 3 weeks after the first dose, your chances of hospitalization whacked down by 94%. And after 2 doses, it's 96% protection against hospitalization. So excellent protection against getting seriously ill. And I think that's what people are worried about, PJ. I mean, I don't really care if I get a runny nose or something. That's okay. What I don't want to do is get really sick. I don't want to endanger those around me. I don't want to go to hospital, and I certainly don't want to die. So, if we're 96% less chance to go to hospital, that's pretty good. I'm accepting that.
And John, where's the data on infectiousness? Because that's been the big question. How infectious am I if I have mild symptoms? Say?
Yeah. It's not absolutely clear on this. The answer is, after vaccination, if you become symptomatic, you are infectious to a degree. Now, there was good data published by the Office for National Statistics yesterday in the UK, looking at someone who has had what you might call a natural infection, someone who's actually been exposed to the virus itself as opposed to the vaccine. And those people do get reinfected. Now, the number that get reinfected is small, and the reinfections are less serious, and they have less symptoms, and the symptoms don't last for as long. And this is because we now know they have a lower viral load. So people that are reinfected have way fewer viruses as measured by the PCR test, way fewer viruses. If they've got fewer viruses, they're going to secrete less viruses, so they're less infectious and they're less likely to get sick. And it appears it's the same with the vaccines. So it's important to know that people who've had the vaccines, and pick the words carefully here, are probably less infectious if they become symptomatic, but must consider themselves still infectious to potentially infect unprotected people if they become symptomatic. That's important to know.
So the best thing to do is, if you should pick up any symptoms at all, just isolate yourself.
I'm afraid. Yeah, we'll talk about the symptoms in a minute, but I think you have to assume that and get tested.
Take yourself out of circulation and get tested
until you get a negative.
Can we look at the AstraZeneca figures?
The AstraZeneca vaccine. So efficacy against symptomatic symptoms after 1 dose is only 30%. And after 2 doses, it goes up to 67%. Now, that sounds a lot less than the 88% for the Pfizer, which is true. But again, the symptoms are milder, they don't last for as long, and there's fewer of them in the vast majority of people that still get it. But that does mean that people that do become symptomatic after 1 dose or 2 doses, as you've just emphasised, PJ, do have some infection risk for those around about them. Okay. Now, with the effectiveness against hospitalization with the Oxford AstraZeneca, and just to remind ourselves, it was 94 and 96 with the Pfizer. With the AstraZeneca, it's 71% protection against hospitalization after 1 dose and 92% protection after 2 doses. But there is a proviso here to bear in mind, because the data is taken about 3 weeks after the 2nd dose, when the Pfizer immunity is probably reached as high as it's going to get. What seems to be happening with the Oxford adenovirus AstraZeneca vaccines is the immunity seems to keep carrying on increasing beyond that 3-week point. So I would expect about a month or 6 weeks after vaccination, those figures to be comparable. So we are seeing great protection against hospitalization, whichever vaccine people get. Now,
do you have data on Johnson & Johnson, or is it too early to say?
It's too early to say from the UK data. That's all that's published. Now, the Janssen Johnson & Johnson was rolled out in the States quite extensively, and the Delta variant in the States is up to about 26% now. So the data that they have on the efficacy when they were using a lot of the Janssen Johnson & Johnson was based on the previous variants. So we don't have firm data on that, and the same applies to the Moderna. But that data I've given you from the Pfizer BioNTech and the Oxford AstraZeneca, that's based on large-scale epidemiological studies by the ONS in the UK countries, and I would expect it to be the same in Ireland. In fact, I would expect it to be the same pretty well anywhere. So very high levels of protection against serious disease.
One thing that we are concerned about with regard to the vaccine rollout, and we featured it a lot in the program, is that in the 60 to 69 cohort. They all got a first AstraZeneca. So too did a lot of healthcare workers got a first AstraZeneca, but they didn't get a second. Now there's a lot of people out there haven't yet had their second. And among them too, of course, John, would be people who are immunocompromised, immunosuppressed, cancer patients, people with autoimmune diseases. And we would be very concerned for them. How important is it that we get them their second jab as quickly as humanly possible?
Yeah. There's 2 points there, PJ. The first is the gap between vaccines. Now, people do have a 4-week gap between the vaccines, or sometimes a 3-week gap. But the data for the AstraZeneca vaccine is definitely showing that the long-term immunity is better if you can have an 8-week gap. So that is good news in so far that a lot of people will have an 8-week gap, have their second dose. 2 or 3 weeks after that, they'll have a higher level of immunity, or at least the level of immunity we believe is going to last for longer. So it's a short-term danger, but it's longer term. It's good news.
Now, we have a lot of people out there, transplant patients, cancer patients, would be very concerned. People who are naturally immunosuppressed or immunocompromised, and they're saying, and I think, should I start to cocoon again, or as you called it in the UK, shield? Should I start to do that?
Well, that's a very good point. Now, there's some people, as you've said, who are immunocompromised for whatever reason. People on steroid drugs for inflammatory conditions, for example, asthma or Crohn's disease, or people with cancer, unfortunately, people with cancer treatment therapies, people with HIV, people that are taking immunosuppressing therapies, for example, for organ transplants, and particularly people who have blood cancers are particularly at risk. Now, data so far in the UK is starting to indicate that these groups of people are not generating the immune response after 1 or even after 2 doses of the vaccine, unfortunately, because these factors, whether it's the drugs or the disease state, are preventing the normal functioning of the immune system. Now, given that the Delta variant is increasing in Ireland, and I think we're probably about, 50% now of the cases of Delta variant, PJ?
Yeah, roughly. And they imagine it will dominate within another couple of weeks.
Yeah, I mean, basically it's doubling every week. So what I would anticipate is within 10 days in Ireland, it's going to be 95% plus, the same as in the UK, unfortunately. So it's so much more transmissible. And I'm afraid that does mean that these people who are immunocompromised are very vulnerable to catching this. There's no question about that. Now,
even if they're double vaccinated?
I'm afraid so, yes. I'm afraid that is what the data is showing. Now, given that you're expecting things to peak in Ireland probably mid-August in terms of the Delta variant, so that means by sort of September, October, the cases will be down. Your vaccination program is ramping up. So I am highly optimistic about good levels of community or herd immunity in Ireland by autumn. So I would be optimistic that the winter wave, which there will be some increases in winter because of the weather and people more indoors, but I'm optimistic it will be minimal. But these people who are immunocompromised, who aren't generating immune response properly, I'm afraid the safe thing for them is to guard for a few more months. I know everyone's completely sick of it, but I really do believe we are in the last furlong. So well, I really believe that. So just this last effort, it would be so terrible if they'd been protecting themselves since March 2020, and then they've got a bad COVID case because of immunocompromise, on the last furlong. Ideally, of course, everyone should go to their own doctor and have their immunity assessed. These people can get their antibody levels tested. There's more sophisticated tests which can look for the long-lived memory T and B cell response. And their consultants, especially if you can get to a hematologist or something, or whichever consultant are treating them, they should be able to tell them what level of immunity they have. But we know that the probability suggests that these minority of people, but in very important minorities, the people that are suffering already, we know that they are going to be at greater risk because they are not generating the immunity that hopefully you and I would generate if we're reasonably healthy.
John, I know you don't like to speculate, but I did watch your interview on Deutsche Welle last week, and I used a clip of it on the program because something that people are asking, they're asking us and they're asking everybody else, they're looking at the European Championships. They're looking at Wimbledon.
Yeah.
and they're seeing full stadiums. And we here, with a capacity of 80,000 in our biggest stadium, have going to maybe 5,000 in it. And people are saying we're outliers, we're backwards, we're behind the curve. John, are we doing the right thing by keeping the crowds small?
Yes, I really believe you are. There's two factors there. So this Delta variant is at least twice as transmissible as the original variant. So basically, they said that the UK Kent so-called Alpha variant now is about 40% more transmissible. They're now saying the household transmission of the Delta variant is another 64% on top of that. So, if you work out your maths, you're talking about 130, 140%, more than double in terms of transmission. Now, remember, PJ, we had a lot of riots and things in the United States and demonstrations last year. We're concerned about outdoor transmission there. Now, those fears never came to fruition. The outdoor transmission in the first wave with the wild type variant was not occurring. But this new variant is probably transmissible enough to spread outside. Now, that's based on limited data at the moment. But of the people that went from Scotland to London to watch the football in London, nearly 2,000 of those have since tested positive for the Delta variant. That doesn't mean say they got it at the football, because they were sharing the same hotels, they were driving there and back in the same buses, on the same trains, they were drinking in the same pubs. So there's other places you could get it as well. But there are 5 cases from Denmark where the epidemiologists do believe they caught it actually at the game. Now, whether that was at the game or in the toilets related to the game or in the tea shop at the grounds or whatever, we don't really know. But there is a risk, and until it's demonstrated that this virus can't be spread outside, I think Ireland is erring on the side of caution. But that's always important to remember. It's not just the game; it's the travel to it. It's all the sort of before and after activities that goes with that. Okay. And again, for the sake of another few months, we are so nearly there, PJ. We just need to make this last final push, and I really believe that herd immunity is basically going to take over and start protecting us.
John, I look forward to that day, and thank you very much for being with us again.
Pleasure, PJ. Thanks for having me.